Malignant mesothelioma is a tumor of the pleura, or the lining of the lungs, the peritoneal cavity, the lining of the abdominal cavity, or the pericardium, the lining of the heart, that can spread to other parts of the body and can be deadly. It is a relatively rare tumor with only 2,000 cases diagnosed in the United States each year, but the numbers have been increasing every year. It can be difficult for a doctor to diagnose because it presents with symptoms that can be difficult to describe or even notice, and it has a long latency period between exposure and disease. The symptoms include cough, shortness of breath, fatigue, and weight loss, to name a few. Symptoms of mesothelioma often do not develop for 30 to 50 years after the original exposure to asbestos, so oftentimes the patient cannot even remember the exposure that occurred. To diagnose mesothelioma, the physician must get a detailed history and physical exam, and then get imaging studies such as an X-ray and CT. Then, a biopsy of the mass or removal of the fluid around the lungs can be done to look for the mesothelioma cells. Once one is diagnosed with mesothelioma, sadly, the average lifespan is only 8 to 12 months. The three options for treatment are surgery, chemotherapy, and radiation therapy. Mesothelioma has been proven many times to be highly correlated to asbestos exposure. The exposure to asbestos is through inhalation in the respiratory tract. The asbestos particles are very small and needle-like and travel to the very end of the respiratory tract, where they become embedded and can cause cancer years later. In fact, in 70% of all cases, asbestos exposure has been found in patients with mesothelioma, and it is presumed that all mesotheliomas are related to asbestos inhalation, but that the other 30% just cannot be proven. Asbestos has been found in many different objects employed in everyday life, especially cement, brake linings, roof shingles, flooring products, textiles, and insulation. People who regularly work with these items are at the highest risk of developing mesothelioma, especially if they smoke. The first people diagnosed with mesothelioma and who had provable job related to asbestos exposure were shipwrights in World War II. Auto mechanics are one set of workers that is presumed to bear a higher risk of mesothelioma. Auto workers are exposed to short chrysotile fibers during installation and repair of asbestos-containing brakes. Asbestos is used in brakes to serve as a heat control. Brake replacement involves two potential opportunities for release of asbestos fibers. Small amounts of chrysotile asbestos may be present in the brake wear debris, and asbestos can be released during grinding and beveling of new asbestos brake linings or pads. So far, studies of mechanics have not been conclusive as to whether they do in fact have an increased risk of the cancer, but experts continue to debate and study this issue. The families of auto mechanics are possibly also at an increased risk for mesothelioma, as the asbestos fibers get embedded in the clothes of the worker. When he or she goes home, the fibers travel along. Then the family breathes in the fibers and receives the same exposure. If you work in an industry or have worked in an industry with asbestos exposure and have any symptoms or any concerns about mesothelioma, please talk to your doctor about your concerns. Thank you for watching. This video was produced by Asbestos.Net, a leading resource on all aspects of asbestos and mesothelioma. Our priority is to inform victims about the devastating effects of asbestos exposure, mesothelioma, asbestos cancer, asbestosis, and other asbestos-related diseases, and to advise them with a wealth of information. Individuals whose lives have been touched by mesothelioma have numerous questions and concerns. Their caregivers and family members also need accurate, reliable information. If you or a loved one have been diagnosed with mesothelioma or asbestos cancer and need more information, we invite you to visit and explore the thousands of pages of oncologist-reviewed material on Asbestos.net, to call our convenient toll-free number shown below and speak with a mesothelioma specialist, or to use the simple contact form found at Asbestos.net to request a free copy of our informative books, custom inserts, and DVD. Asbestos.net.
information, and help for patients and families.